Hello, everyone. This lecture of ethics and pharmacy practice will be talking about special subjects like special pharmacy related services and activities. We will be talking about drug and poison information, health promotion and public health services. And finally, we will talk about traditional and complementary medicine. We will compare those two. Let us start with a poison. This part will be talking about drug and poison information. And if we ask ourselves, what is a poison? Pharmacology interacts with toxicology, or it intersects with toxicology. There is intersection between the two fields when the physiological response to a drug is an adverse effect. So basically, like a toxin or a poison, the adverse effects is what is the expected physiological effect in that poison. So a poison is any substance, including any drug, that has the capacity to harm a living organism. Think about any poison that you have. So the difference, remember, the difference between a drug and a poison is basically the dose. Everything can be considered as a poison, but it depends on what is the dose that we are talking about. And poisoning generally implies that damaging physiological effects result from exposure to pharmaceuticals, illicit drugs, or chemicals. So it entails, or it consists, or it includes several things. Not only pharmaceuticals, but it could also refer to illicit drugs and or chemicals. The poison control, poison information is a specialized area of drug information, with the practitioner typically practicing in an accredited poisoning or poison information center or an emergency room in the hospital. So in a drug information centers, normally healthcare professionals, they generate most consultations, whereas in a poison control center, most are generated from the public. So you will get queries or inquiries from the patients themselves or their parents, their family members, etc. That's the difference between a drug information center where the healthcare professional will be asking those questions and the pharmacist would answer them in a drug information center. However, in a poison control center, the difference is the customer, let's say, is the general public, not the healthcare professionals. And poison control centers may be prepared to provide information on management of any poison situation, including household products, whatever that toxin is, like household products, poisonous plants and animals, like snakes, scorpions. These are toxics as well, poisons. Medications are considered poisons. Imagine somebody, a child took, for example, a bottle full of a drug or medication all at once. This is a poison, of course. Other chemicals that normally we have in our household, like chlorine or any chemical substance for cleaning the house, detergents, etc. Because of the type of information that the specialist provides, nearly all requests for information to a poison control centers are urgent. Normally, these are urgent inquiries, urgent requests that the pharmacists need to handle very quickly because we cannot wait. Sometimes you can save the patient life if you respond very quickly and an action has been taken. So in poison control, a specialist in poison information requires expertise in a clinical toxicology. This is the qualification that's needed to have a clinical toxicology, to be able to obtain a complete history that correctly assesses the potential severity of exposure. They need to know where and how to search for this type of information. They also need to be able to develop a suitable plan for intervention. What is the treatment plan for that? Not only the information, so you need to know, or the pharmacist has to know where and how to search for that type of information. They also need to be able to communicate the plan in a comprehensive, concise, and accurate manner to a consumer at an appropriate level of understanding. You explain it to them in a language that they understand, not a lot of scientific terminology that a normal person would not know all of these details. Now, in Jordan, we have the National Drug and Poison Information Center. And the National Drug and Poison Information Center was established in 2004 by the Jordanian Swedish Medical Association and is located in the Emergency Department at Jordan University Hospital. So موجود في الجامعة الأردنية في مستشفى الجامعة الأردنية وتم يعني إقامته بمنحة من الاتحاد الأطباء السويدي. It is the one and the only center that provides poison information, 24 hours emergency telephone management and consultation free of charge for all citizens in Jordan. It collects data and delivers professional and public education. I also included the link below. If somebody is interested to know, you can search the website for the University of Jordan Hospital. So what is the center mission? The center mission is to prevent poison exposure, save human lives, and limit injury from poisoning through dissemination of poison information and treatment advice, public and professional education, and scientific research. So it's a multidisciplinary center, of course, for patient care plus educational mission. The center decreases healthcare costs of poisoning cases and minimize adverse effects of exposure to drugs, poisons, chemicals, and natural toxins. So it's a multidisciplinary, as I just mentioned. The vision of the center, National Poison Center vision, is to be the regional leader for excellence in poison prevention, education, research, and treatment. This is the phone number if somebody is interested. Anywhere in Jordan, you can obtain emergency information on. These are the list of services that the center is providing, like drug overdose, any household chemical or pesticide exposure, any gas inhalation, snake bite, scorpion sting, other animal or insect sting or bite, plant toxicity, and drug information, of course, regarding these drugs. So here's how the center would help. First of all, as I mentioned, it's free of charge for patients and their families. They save lives and reduce illness from poisoning. And a quick action could save a life. As I mentioned, you have to move very quickly. About half of the poisoning emergencies involved in Jordan are children, but they also provide immediate life-saving information for medical error, medication errors, chemical spills, occupational exposure, drug misuse, and drug interactions. They reduce healthcare costs as well. A lot of poisons could be treated at home safely. They reduce the healthcare costs and save emergency doctors time. Instead of going to the emergency room and pay a lot of expenses, they could be handled at home with just some recommendation or information instructions on how to deal with that poisoning situation. They carry out health education lectures for both public healthcare professionals, students, residents, fellows, etc. The drug information may be patient-specific or developed for a given patient population regarding drug information. So the drug information provision has evolved over the last 50 years, and the focus has shifted from medication safety, advances in pharmacy informatics, evidence-based medicine, formulary management, medication policy development, and new environments of care. As you see, there are a lot of new fields that have emerged recently because of the advances in knowledge. So with computerized also medical records and order entry systems now available to pharmacists, drug information specialists can take a leadership role in incorporating automated interventions that improve safety and provide education at the point of prescribing. So drug information specialists and a clinical specialist must keep abreast of advances in information technology. So they have to know the advances in technology because they are very helpful in their field. They can utilize them to improve patient health care. And biomedical literature also, evaluation. Now we have plenty of resources that we can use as healthcare professionals to utilize these biomedical literature evaluation skills and devices and tools. So leadership and career opportunities exist in a variety of settings for a drug information specialist. As the role of the practicing pharmacist has changed. Now, the practice of pharmacy has recently changed with advances, as I mentioned, in the information technology, in the systems, in research methods. So the specific or the traditional role that the pharmacist has always had before is changing. The role of the drug information specialist has changed from an individual who normally answers the questions to one who focuses on development of medication policies, and it provides information and complex drug information questions. Not only those simple, but how to change the medication policy, which would first improve the quality of life of the patient, and number two, reduce the costs on the health sector burden. So leadership and career opportunities exist in a variety of settings for a drug information specialist, including health system pharmacists like hospital pharmacists. These are examples for new roles or other roles for the pharmacists they could work on. A contracted drug information center. So you work in a drug information center, for example, answer questions, develop policies. Pharmacy informatics, because with the advances in IT, so everybody is now talking about big data and the informatics. Also managed care organizations like those who are specialized with the health systems, like organization HMO, Pharmacy Benefit Management Organization, PBMs. So these are organizations related to drug treatment and providing healthcare. Scientific writing and medical communications. If you see the leaflet, if you see the brochures that normally drug companies they have, there are certain articles in scientific journals. Who writes those? Typically a pharmacist or a physician or somebody from the medical field. So this is a good opportunity for pharmacists to explore. As I mentioned before, poison control centers. A pharmacist with training in a clinical toxicology can work as a poison control. They could also work in pharmaceutical industry, whether this is in manufacturing or R&D, research and development, early in drug discovery. Also, they could work in academia. So these are non-traditional or other roles a pharmacy or a pharmacist could develop. A drug information specialist can be involved in multiple activities in a practice settings as listed below. So there are also institutional health system and drug information services. There are opportunities existing for drug information specialists in most health system pharmacies. For example, roles covered by drug information specialists in health systems often include managing the formulary system. Managing formulary, we see this in all hospitals now. They have their approved formulary. This is the list of approved medications they could dispense for their patients. Medication safety programs, or what we call it pharmacovigilance. Pharmacovigilance is recording the side effects or adverse events reported by patients, their customers, their parents, their families, anybody who knows about medication. Let's take, for example, corona vaccine right now. Anybody can report a side effect. They cause headache, they cause joint pain, they cause muscle pain, etc. These are the medication safety programs. Medication usage evaluation, evaluate the usage of the medication. And also they are involved in medication policy development and management. So drug information practitioners are in an invaluable position to provide a service that will improve patient outcomes and decrease healthcare costs. So these are the ultimate two goals that we are normally looking for, is to improve the quality of life, to improve the patient outcome, and we need to reduce the health costs, healthcare costs, whether you're talking about number of days a patient would spend in a hospital or hospital admission. So through provision of unbiased information that supports rational, cost-effective, and patient and disease-specific medication therapy. With formulary management, more emphasis will be needed on evaluating non-traditional medications such as herbal and natural products, compounded products, and biosimilars to determine if they have a place in the formulary. So why don't we look outside the box and see what other medications like herbals, natural products, compounded products you do? This is the pharmacist's role also to do compounded products. And biosimilars, these are the biologics that they have their patent has expired, and now other companies, they can manufacture them. We call them biosimilars. So formulary management software. The formulary will need to be evaluated and implemented, and automated formulary restrictions and decision support will need to be developed. In addition, drug shortages and counterfeit medications will need to be addressed. So these are areas for the pharmacist to also work on. Counterfeit means adulterated medications, or if there is a drug shortage also. These drug information practitioners also be tasked with the decision that the drug information resources to be used by healthcare professionals in health system, publishing drug information newsletters and managing websites where we talk about medications. These are specialties for pharmacists. So if you have interest in IT, technology, plus your pharmacy experience, you could combine both, working on drug information, newsletters that will be sent to healthcare professionals or even to patients, and managing websites that are related to certain medications. The next one, I'm going to be talking about contracted drug information center fee for service. Another way to deliver evidence-based drug information services by contracting with a drug information service with formally trained drug information specialists, in other words, a pharmacist. So you could be contracted or hired of a full-time employee. So patients or potential a client would include managed care groups, contract pharmacy services, federal or state government, pharmacy benefits managers, and buying groups, attorneys, pharmaceutical industry, small hospitals, chain pharmacies, independent pharmacies, and nursing home chains. So these are some other contracted drug information centers fee for service where the pharmacist can charge for that service. And the services provided within these contracts may include providing answers to medication information requests. Anybody who can ask you questions from the healthcare professionals or team, preparing a new drug evaluation monographs or class reviews. Of course, you have to know methods how to search literatures and obtain that information, when and where to obtain that information. Developing medication use evaluation criteria, preparing pharmacoeconomic evaluations. Pharmacoeconomics talking about comparing the costs of medications or treatment options. What is the least expensive with the good outcome for the patient? Developing guidelines for a particular disease, and writing a pharmacotherapy publications, websites, blog, newsletter. You supervise a website, for example, and providing continuing education programs, or we call them CPE, continued pharmaceutical education. So let's talk about managed care pharmacy. With total U.S. drug expenditures for pharmaceuticals increasing annually, there are tremendous opportunities for the drug information specialists to provide leadership in the development and implementation of mechanisms to support the cost-effective selection and use of medications managed pharmacy organizations. So these are organizations that manage medication treatment with the low cost or the best cost-effective selection. With the appropriate training, pharmacists should be trained, specialized residency in drug information. There is a residency, by the way, in the U.S. for drug information in practice or managed care pharmacy. So you gain more experience in that, and expertise opportunities are growing for the drug information specialist in the insurance industry. So even in Jordan, you could work on pharmaceutical insurance companies. They are providing more information about which medications should be included in the formulary, and they answer questions about what is the indication of that drug. Is this a drug approved from insurance perspective or not? The HMOs, these are organizations for healthcare, PBMs, the state and national government agencies or Medicaid, Medicare, other groups interested in the cost-effective use of medications. So a list of residencies, by the way, in managed care pharmacy is available through the Academy of Managed Care Pharmacy, AMCP, and this is the website if you are interested in looking for these types of residencies. A drug information specialist may also be involved in several activities, which include providing medication use evaluation, assessments, encouraging the use of cost-effective alternatives, providing medication and practice-related information, managing formularies, providing information to support formulary guidelines, and developing disease management programs. So all of these within the main focus of the pharmacist, where the pharmacist can use any of these fields to improve their skills. The practice guidelines are becoming an increasingly important part of the biomedical literature, and these clinical guidelines are systematically developed to assist healthcare professionals and patients with decisions about healthcare in an effort to improve the quality of and consistency of healthcare while minimizing costs and liability. The evidence-based medicine, we call it, or evidence-based practice guidelines are developed through systematic reviews of the literature. And this is part of the study design or research methods where you review large number of studies. For example, if you're talking about COVID-19, you want to see the effect of COVID-19 on diabetic patients, so you collect all of the data. That's why we call it systematic review. You pool these data together and you come up with a publication appropriate, adapted to local circumstances and values. So the key questions to consider when reviewing a practice guideline have been proposed, and these questions primarily rely on how accurately they are. Now we move to the complementary medicine, the last topic in this chapter. Some persons seek healthcare from alternative providers outside of or in addition to the conventional scientific medicine. So the traditional way, you go to the physician, you get a prescription, you go to the pharmacy, fill that prescription, and you use the medication. It's estimated that 1 out of every 3 adult Americans make a total of 425 million visits to alternative providers, more than are made to primary care practitioners. So there is some tendency to use these alternatives methods or call them complementary medicine. They provide neuropaths, homeopath, chiropractors, acupuncturists, and practitioners of traditional Chinese, Indian, or Native American medicine. So we have other alternatives to the traditional medicine that we normally work on. In several states, homeopathic and naturopathic doctors are licensed as medical practitioners. They have a physician license, of course. And methods they normally use in these complementary medicine, spiritual healing, physical manipulation, special diets. They rely only on food because they said that we could control a lot of diseases by just food restriction. Imaging techniques, relaxation techniques, massage, vitamin therapy. Attention is paid to nutrition, exercise, and stress reduction. These methods are described as alternative or complementary medicine. Integrative medicine designates programs that attempt to find and utilize the benefits of both alternative and orthodox medicine, and some prominent medical institutions have established programs in integrative medicine. So it's widely accepted in certain traditions in science in comparing this to the traditional medicine. Would like to thank you, and that's the end of the presentation. Thank you.